think the thing about journalists is that they often go into the profession because they're curious or nosy. They want to know about other people's stories. And they also want to go into it because they want to help them tell their stories. And often journalists have a really deep, empathic response to those stories. That's why they go into it in the first place. They think there's something important to say, and perhaps people aren't being allowed to say it, and that's what they want to do. So I think a lot of journalists have a sensitivity, I guess, to the things around them, the news stories around them, the people around them. That can also make them vulnerable when difficult stuff happens and when they have to hold on to a lot of traumatic events. And also, I think typically with journalists, they will go to something difficult and challenging and deal with it and report on it and talk to people at their lowest point in their lives. Often, as journalists, when we do a news story, we are talking to someone who is at their very lowest point, who've experienced the worst thing possible for them. And I think I became very aware very quickly that we had a responsibility to hold those stories well. And if we were to do that, we needed to be more understanding of the role of the brain and how to protect people and what to look out for if they were too traumatized. How far do you push? What is ethical? Where is consent? So all those issues have always been very important to me when I started in 1986. But that's what drew me towards learning to be a trauma assessor many, many years ago, then doing a master's in psychology with a focus on journalists and recovery after trauma, and then doing a professional doctorate in counselling psychology, where I went into the NHS and various other areas, and now continuing to help journalists manage what they do because storytelling is an incredibly important thing, and we need to protect those doing it.